From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
With me now is Dr. Cindy Stark. She is a medical doctor and has a PhD. She's a transformational health expert and a board-certified internal medicine physician. And she and I are going to be talking today about surviving the pandemic and beyond, mental health empowerment for professionals today. All right, Dr. Stark, tell me what that's about. Tell me about empowerment for professionals.
Well, you know, all of us professionals, we have so many things that are weighing on us every day. And if we don't have our mental health about us, then we can't, effectively do our jobs, for me, it's taking care of my patients, my children, my husband, and we all wear so many hats in this world. So if we don't take care of ourselves, we really can't take care of the ones that are entrusted to us. So it's just of utmost importance.
Okay, and so talk to me about how you get started. You have on an outline that you sent me, guided meditation for post-pandemic stress. How's that going to work?
Okay, Don. So with your permission, what I'm going to do, and I want you to do it with me, and I'm going to do it too, okay? It's going to be a 5-minute guided meditation. I'm going to play some music, and I want you to tell me if you're hearing what I'm playing here. I'm going to get it started. Tell me if you can hear it.
Need it a little louder.
Okay.
That's good. You got it.
Okay. Okay. Now I want you to sit on the edge of your seat, put your spine straight up, and close your eyes. And I'm just going to guide you through something. I want you to take a really deep breath in your nose, hold it, and then exhale. And let's do that one more time together.
Everybody
Inhale
at home do this
nose.
too.
Everybody at home do it too, please. This is the key to your mental health. We're going to be working on all of our mental health collectively. The whole entire country, we're working on our mental health together. Right in this moment, right here, for the next 5 minutes. So once you get centered in your breath and just listen to the music in the background, I want you to know that you're going to be staying lucid, and I want you to be paying attention to what I say throughout. And you might notice some changes in the quality of your mind state. You can practice this exercise anytime you want to, whether your eyes are open or closed. But the more that you invest your attention, the more you're going to notice improvements in your life. Notice where you're holding tension right now and try as best as you can to let it melt away. Let your shoulders fall and relax. Ease any stress that's in your jaw, around your eyes. Let your whole face relax. And briefly just go through all your major body parts, relaxing one by one. And know that the more you practice willful relaxation, the deeper and quicker you're going to relax, until eventually you can just thoroughly relax extremely deeply in the space of just a few breaths. I want you to imagine yourself in a relaxing, private place by a beach or a forest, or even your own bed, and feel how tranquil that place can be. Eventually, you're going to be able to come to perceive the activity of your own mind in such a way that you can tell the brain waves to willfully slow down so that you enter into a comfortable state of relaxation. Try not to make any effort at all, just centering yourself inside, deep down inside, from the inner creative part of your mind. Visualize yourself now living the life that you aspire to have. See yourself in a situation that confirms to you that you've made it. Your life and your health and your happiness is thriving. It's 2022 and we are all at peace and life is back to normal. You've set into motion the systems that ensure your success, and now you're reaping the benefits of your work. Live it now as if you're already there. And every time you practice this exercise, you can think of a different situation that confirms your success. You're thriving. Your family's happy. We're going to concerts again, sporting events. All the kids are in school again, and we don't see masks anywhere. You're sleeping 8 hours a day. You're waking feeling refreshed and energized. You love drinking water, fresh fruit, vegetables, and walking in the sunshine daily. You get help when you need it. You can use a familiar one for you, something that makes you happy, like laughing with your kids, vacationing somewhere nice, anywhere you like. And as you live this most enjoyable moment, you take stock of your situation. You realize what an important impact you're having on the lives of everyone around you. And everyone around you is able to help other people around them so that they can offer more of themselves. So in unfathomable ways, you're creating a never-ending ripple effect of betterment and goodness in God's earth. This fulfillment reflects itself in every aspect of your experience, every part of your life, every person. How is your success showing up in your surroundings? The home that you own, the financial stability that you have. Visualize all of this as if you're living it right now. And as you realize this and visualize it, rehearse it mentally, establish the blueprint that your unconscious mind is going to follow to make this reality in your life from now on. And feeling this new reality taking shape inside of yourself and later to be reflected outwards into your life whenever you like, you can now stretch or flex your muscles, energize yourself, open your eyes, and come back into the room. How is that for you?
Not bad. I don't get to relax like that at work very often.
I know that's what everybody says when I do this exercise with them.
Very good. How much do you do that once a day? Is that a once a day thing that we should do?
Yes, I do that once a day. Here's the deal, Don. I have to link it to something that I really love doing because otherwise I won't think that that's important. And so one thing I love doing every day is making myself a cup of coffee. So I make myself, I schedule it. I kind of link it to my coffee drinking. So I give myself 5 minutes and I do that every day.
All right. Well, what are some of the next things that we're going to do? First of all, tell me a little bit about you, if you would, please. Tell me who you are and
Yes,
what
sir.
you've been doing all your life. But don't take too long.
Okay. Okay. I'm 51 years old. I'm a doctor here in Gainesville, Georgia. I take care of patients at Long Street Clinic. I'm a hospitalist, so I take care of hospitalized patients, but I'm also a mom and a wife. I have little teenage children. One's at the University of Georgia and one's a senior in high school. And on the side for the last couple years or so, I've built a transformational health program to help people around me all over the world transform their lives from the inside out, using the power of their mind to help have the life and the body that they want.
Okay.
Is that short enough?
Yes. Please feel free to take as much time as you think you need. What are the keys to success during the pandemic? What did you do during the pandemic to make it through?
Yeah. So, for the past 14 months, I was considered one of those frontline workers. So I saw, unfortunately, a lot of people losing their jobs all around me. And I was considered an essential worker. So I found myself feeling extremely blessed to be given the opportunity to not be without a job. But then at the exact same moment, extremely stressed out that I was over there in that hospital and the National Guard was all around us, Don. We were like building up these makeshift tents, literally made out of like a camping tent just to house the masses of people that we were expecting to come our way. And, we built this thing called a mobile medical unit too. And it was like we were living in a movie, like a war zone. It just seeing all this National Guard, personnel around us on the hospital campus, it was extremely frightening. And so I decided really early on, I don't know how long this is going to last. I think we all hoped it was only going to last for about 4 or 6 weeks. But, 2 or 3 months into the process, I realized this isn't going anywhere. So we really, all of us really, really better find something that we can do. I call it, don't waste the pandemic. Don't just sit there and be scared and huddled up, eating ice cream and biscuits and gravy and watching news 24/7, because that's just going to make you so scared. So I just said, you know what, I'm going to have to stay positive. And I told everybody the rule is no more television in the house. So rule number 1, no more television in the house. That's how I survived. And that's my biggest tip when things are so stressful and the news just loves, they pay for our eyeball time, Don. And so they make everything seem like a crisis. So no Facebook negativity, no television news. And then the other thing I decided is that we're going to all move our bodies every day. So we literally went out, right, I'm looking at it right now, in our the street where we live on, and we drew a tennis court in the street, and we played, we called it, street tennis. And we just moved our body every day. The whole neighborhood was out playing tennis together. I've never seen so much of my neighbors in all my life. So move your body consistently. And that just helps just get rid of any of the negative hormones that are going on in your body, like cortisol and norepinephrine. And then thirdly is do something inspiring. So my son and I were avid outdoorsmen. And so we would go hiking on the Appalachian Trail and camping. And we would just get our bikes out and just get out into the fresh air and do something inspiring. We would also bake a lot. We made anything that could be made with yeast. So it would take like several days for the yeast to double. We acted like we're having science experiments in the house. We were getting into baking and giving everybody in the neighborhood sourdough bread and blueberry muffins and all this stuff. And then the fourth was consistent sleep. That's when, I don't think people realize this, Don, but when you sleep at night, that is when your body is more active than ever, getting rid of all the toxins, metabolizing anything that you've been exposed to throughout the day, rebuilding anything that was torn. Your body needs a lot of high quality sleep so it can rebuild and rejuvenate you and make you into a better person the next day. So I just made sure to allow myself to have 8 hours of sleep a night, and, get blackout shades for your room, and don't put your television on as you're trying to go to sleep, things like that. And then the fifth and final thing really, Don, was just to invest in myself. Like I said a minute ago, I decided early on I didn't want to waste the pandemic. And so I said, you know what, I'm going to really get serious about building this online transformational health coach business. And so I just poured myself into building myself up and hiring a mindset coach and a business coach. And I started launching this business. So let's just do something to invest in yourself, because I want everybody to know that they're worth it. So those are my keys.
All right. And how has that worked for you so far? We're in a situation where we're coming out of the pandemic. Our state's a little behind others because we're more conservative here in terms of our state government. They want us. I'm still wearing a mask in the hallways. But how was that working out for you? How did that work out when you did all of those things?
Well, most of the things that I listed here were things that I could either do in the great big, great wild outdoors. So we could be really far away from people. Like when we would go hiking, we would not wear a mask, but we all stood about 20 feet apart from each other. I mean, hardly anybody was out. I think most people stayed home, Don. And so we would actually get outside into wide open spaces so that we were really far apart from anybody. And then the online coaching program that I built, that was just in the comfort of my own home, because we weren't letting anybody come and visit, and even neighbors, and we would stay at least 20 feet apart from them. So we're still, the masks over here in Georgia, they're not required like in restaurants anymore. They're not required in the grocery stores anymore, but in the hospital, we do still have to wear them. So I hope that answers your question.
Yes, it does. Now, you've got written down here on this suggestion to me that we take out a sheet of paper at this time. Can you tell me what we're going to do?
Yes. So and maybe we could give this to your listeners too. So I don't want to take the time for everybody to answer all these questions as I go through them. But if I had more time, I would give them 3 minutes to answer each one of these questions.
Wow.
But why don't, yeah, I don't know if we could give them the questions afterwards or put them on your website.
Okay. Well, I'm not used to being.
I can offer that to you.
Yeah. I'm not used to being the guy answering the questions, but go ahead and ask, and I'll see what I can do.
Yeah. Well, and you don't have to answer them. Let's just put it this way. These are just thoughts to ponder. Okay. These are things for you to think about. So I'm just going to, if I was giving my talk live and to your audience and everybody had a notebook, I would say, get out a sheet of paper and just answer the following questions. Number 1, how many hours per week are you dedicating to taking care of yourself? So just think about it. You don't have to answer it. I'm just telling your audience too. Just how many hours a week are you dedicated to taking care of yourself? And then the next question is, how many hours would you like to dedicate to taking care of yourself? And then the clincher is, what stops you from adding more self-care? Now, for me, I wrote down pleasing others. I let the needs of my kids and my husband and my patients and everything else take precedent over taking care of myself, or I used to. And so I don't do that anymore. And I said, then the next question is, how can more self-care help you? Okay. And what I wrote is that it can de-stress me more and it can give me more life to each one of my days. So how can more self-care help you? And the next question is, who else benefits from you taking care of yourself? And again, it's going to be different for everybody, but for me, my husband would benefit, my kids, my patients, the nurses, my pets, my neighbors, and then of course my brother, sister, nieces, nephews, all that. And then I just wanted everyone to just think about how you would need to be feeling to know that you needed to add more self-care to your calendar. And it's really, in my opinion, Don, what the pandemic did to all of us. It's just made us all feel really stressed out. I think we were all angry. There was a lot of controversy about where this virus came from. And if you think it was used as biological warfare, then, you would be really mad at who developed this virus and who funded the development of it. So people were just getting so angry and so scared. So when you start feeling these little tinges of anger and fear, which is what it was for me, that's when you know you need to add more self-care to your week.
I want to ask, did the doctors, your fellow physicians, did you talk about the fact that people were really getting upset, like you had described there, in this country? We had an increase in this state in our suicide rate. Did you all talk about that while you were practicing medicine and helping people with the actual COVID virus?
Yeah. Yes, sir. One of the saddest things that I will never forget is, and I'm a very emotional person, so I hope I don't get choked up. But if I do, I guess that's okay. But there was an accidental death, a little 19-year-old child in our neighborhood. He was so stressed out because of everything going on. There were people dying so unnecessarily all around us during the pandemic. And this 19-year-old, a son of a very good friend of mine, he was literally stressed out and taking medicines to help him deal with that, and was in a terrible accident and died. Completely unnecessary death. And then us as doctors, I don't think I've ever been so sad with a mask on, goggles on, and then that thing that goes down over our heads, this clear glass thing. Yes. Having to pronounce a patient dead and tell these children, you can't come see your dad right before he dies. They would literally give us, it would be like an executive order we would have to write in the patient's chart to give a patient's family 30 minutes to come if death was expected. And people were just dying all alone. And it was tearing all of us up. I had, it was just one of the most upsetting things I've ever been through. Because as a doctor, you really want to not only take care of your patients, but for me, one of the biggest joys of my career is taking care of the loved ones of my patients. And they weren't allowed at the bedside. And so these people were dying with me as their only person, and the nurses So we all became everyone's family for those 14 months. I mean, it was just really bad. And so, yeah, we talk about it a lot as doctors, and we would have meetings, every Friday, not every Friday, but one Friday a month, just to kind of support each other, because our mental health was really on the line. And I do believe there's going to be some survivor's guilt that comes out of all this, and PTSD once it's all said and done, because it was like we were in a war zone, seriously.
Well, you have given us great advice. I want to ask you, you're a doctor. You worked hard to get where you are, just to be a doctor, just to be a physician. Are we all going to, do we all need to work hard to make life better for ourselves after this pandemic is over?
I really, my hope for everybody is that we realize that we don't have to work really hard, that the things that are most important to us are things that are free and things that are right around us for the taking. I don't think I've ever missed my mom and dad so much. My mom, my dad, and my father-in-law and my mother-in-law, they're all in their 70s or 80s. And so we weren't wanting to see them, because our kids were considered, super spreaders. And so what I wish for people after this is all over is that they really just connect with their family more, and that they connect with themselves more and their neighbors more, and just enjoy the simple things in life, because you don't have to work so hard to have a good life. What we all were missing more than anything is just time to connect. I think that really brought it into crystal clear focus for all of us.
Well, that's very good. I want to say that I looked up your website. I've watched some of the videos that you have on YouTube, and we want to let people know how they can get in contact with you. So why don't you go ahead and give us your website, if you could.
Okay, yeah, the best place to get in touch with me is my website, therealdrcindy.com. I always say I'm Dr. Stark by day and the real Dr. Cindy by night. And I have, if any of this has resonated, and if anyone feels like a lack of connection, not only to themselves, but to others, and they feel like their mindset has just really gotten off during this whole crisis that we've all been through as the world has gone through this pandemic, I just really want them, would just love nothing more than to reach out to me and see if I can be a beacon of hope for them. If people don't want to, push the button and actually undergo the 12-week transformational health program that I offer, I have all kinds of just little ways that I can love on you. And I just think that's one of my greatest joys in life, is just to love on people in a bigger platform than ever before. And it's a all-encompassing way to maximize your mental health, your spiritual health, your body health, and everything. And it's I just really don't think any of us realize just how many parts are integrated into the whole, and every one of them are like spokes on a wheel that need to be working together. So therealdrcindy.com, reach out to me. I'm there all the time.
Okay, and you've been very forward with us about losing some patients and the family off somewhere else because they couldn't be there. It's nice to know how many other doctors are like you. Did most of them who were with somebody have the kind of feeling that you have? You really, I can see it on your face. You were really upset by those people that were there and they were alone. And are there other people in medicine that are that way? I hope there are.
Well, it's interesting because I do believe it's one of the most unique things about me. I always say I got my bedside manner from my mom and dad. I don't come from a family of doctors. I think most doctors, to be able to make it through our job, we detach. And I never learned how to detach. We grew up, my dad was a farmer and, just salt of the earth kind of people. And I love my patients and I love my patients' families. And I don't know if it's very typical or very common, but it's one of the things my patients love about me the most. And I am a bulldog and I fight for them. And I'm just the biggest patient advocate because I just I see myself as if that was my dad or that was me. And I just fight for them because they're so weak and helpless. And so, yeah, I don't really think it's 100% common, but I would say I hope there's at least 30% of the doctors that are like me, Don. But I really just don't know. Sometimes I think people go into medicine for the wrong reasons, and I just went in it to help people. And so I just see it as like God's greatest gift to me is to help his people through their worst times in their life.
Okay. Do you have one thing you'd like to tell people? You see patients every day. One thing that you would tell them that's most important for them to keep their own health and to pay most attention to themselves. We have about 40 seconds left.
Okay, yeah, I just would tell people to learn however it is that you can. Find a resource, reach out to me and find somebody that can teach you how to harness the power of your mindset in getting everything that you want in life. Because people will try this diet or this meditation or, oh, well, let's go walk or let's go find a friend. But there's so many other things that go into it. If you can harness the power of the matter between your ears, you're going to be golden. You can get whatever it is that you want in life. And it's a complicated thing, our brain, but I have figured it out. I've been a doctor for 30 years, and I would just love to share everybody the tools of unlocking that genius powerhouse that's right here between our ears.
Well, Dr. Cindy Stark, I want you to know it makes me feel good to know there are doctors like you out there. And I want to thank you very much for talking with me today. And I'm sure that the information you've shared with us is going to help our viewers here, way over here in New Mexico. And you folks in New Mexico, you follow what Dr. Cindy says, okay? And
Thank you, Don.
you're welcome. We'll say goodbye now.